Hello, everyone. Thank you for giving us the opportunity to demo iCare application. I am Pravesh, and let's see what we will cover in this demo today. So we will cover how to log into this iCare application, how to add a new patient to this application, how to add the patient visits, how to allocate medicine to the patient, and how to browse the old patient history. So let's start the demo. So once you get your login details, once you get your URL, you will get your login details, and there you will put your login details, and you will log into the system. The moment you log in, you will find this help menu where you can go to help and you can learn more about this application. Right now, since I'm doing a demo, I'll just close it. So here in this application section, you will see on the left hand side, we have got the master menu. Then we have got the top menu on the top, and then we have got the application area, which is this body part. So what we will see is we will first browse through, we will first go through to the left hand side, the main menu area. So in the left hand side, you will find we have got dashboard, we have got application help, then we have got upcoming appointments, then we have got pre-registrations. Then if you see this patients menu, once you click on it, you will see list patients, you will see add patients, you will see search patients. So these are like the options over here. Then you will find reports. Then you will see here we find drug inventory. In drug inventory, you've got suppliers, you've got product masters, you've got product requests. On the left hand side, we will again see this TC inventory. If you click here in TC inventory, you will find product wise inventory, current inventory, TC settlement history, add purchase, reallocation, TC dosing history, and find product. So you will find all these details over here on the left hand side. On the top menu, you will find the global patient search option, where you will be able to search any patient registered in this system in your area. Here you will find your treatment center. Right now it is a demo center. Then on the rightmost, you will find your menu, your notification center. So in the notification center, you will find all the notifications that are generated. Here on the right menu, you will find my account settings and logout. In the main area, you will find notifications, number of enrolled patients, the total visits, total appointments, and here you will find a graph where you will find various diagnoses like hemophilia A, B, etc., and thalassemia, and number of patients in these that has been registered. Right now, there are only two patients registered. One is for hemophilia, one is for thalassemia. After that, you will find ABR, severity report, joint bleeds, other bleeds, joint score, chronic complications, weight-wise, age distributions, education-wise, visit reason, economic status, visit reason, etc. So we have got all these graphs which will get populated once the data has been real data has been inputted. So let's learn now how to add a new patient. So on the left hand side, you go to the patient option, you click on add patients, and you will come to this area where you will have to select whether the patient is hemophilic or thalassemia. So we will say go for hemophilia A. We'll select hemophilia A and we'll start the patient registration. So once we click on the patient registration, you'll find there's a registration ID which is auto-generated. If you have your own local registration ID that you can input over here, which you will be able to search also locally. Then if you see there are like these mandatory fields like patient name, date of birth, gender, Aadhaar belongs to Aadhaar card number. So these are the minimum fields that are required to register a patient. Once you do that, you will be able to easily register the patient. But we have got many more information boxes over here which you can actually fill if you have those details right away. Otherwise, you can just fill all these mandatory fields and the patient will get registered. So if you see, we have got this general entry, then we have got this residential address, mobile phone, all this address of the patient. Then we have got this clinical primary. We have got all the date of diagnosis, history of bleed disorder, frequency of bleeds, etc. So these are the details which you can fill if you have those details available at that at the time of registration. Then you have got this vaccination. So these are all details which you can fill it at the same time, or you can fill it later on once the patient gets registered. And once you have filled all these details, you can click on save all or add next step depending upon what you want to do. So once you click on save all, the patient gets registered and they will be allotted a new registration ID, which you will be able to see from here. If you click on list patient, once the patient gets registered, it will get listed over here. So in all patients in the list patient menu, you will find all patients over here. Here you will find various filters like all, allied, disease, duplicates, and then you can also search from which date to which end date the patient has been registered. There are various filters available for your convenience. So you can basically search different with filters. You can also search directly. Suppose I want to search for Randi, so I can just click on RA and I'll be able to find the patient. So once you register the patient, you will be able to see the patient in this patient browser, this list patient. Here you are seeing that there are lots of options here in the left hand side of this under this action column. So in this action, we have got view patient. Once you click on view patient, you will be able to see all the details that you have entered. These are the details that you entered at the time of registration or later on also. Then we have got this patient timeline, which will show when the patient actually got registered and if there is any mandatory changes that has been made in terms of the patient profile. Then we have got this appointment center. Then we have got this report. Then we have got this edit patient. So if you once the patient is registered, you can click on edit patient and you can fill up all other details that you want. So you can easily update all these details. If you see, we have got there are two more options which are like transfer patient and update diagnosis. So suppose while registering the diagnosis, you think that at the time of registration, it was diagnosed as hemophilia A, but uh, after diagnosis, after the report came, it became hemophilia B. You can basically update it from this update diagnosis. If you click here, you can basically select the category and update it. Similarly, if you can transfer the patient, suppose the patient is registered at your center and he has due to his job he is shifted to another, he is basically transferred to another district or treatment center. Under treatment center, you can transfer the patient. You can just select the treatment centers and with a note you can transfer the patient from one center to another. So this is how you register the patient. Now let's again see what else is there. So once the patient has been edited, means the profile has been edited, you can see there's a health record, then there's delete patient, and then there is create visit. So once it is registered, you do not need to register the patient again and again. Then you just need to create a visit. So once the patient is registered, you click on creating a visit. So suppose we want to create a visit for today, we will just do that. We will click on create visit and you will find all the patient details over here. You can click on date of visit. We have currently open the details so that you can basically put historical visits if you like. Then we have got this patient has come for hospitalization or consultation. You can put any ward number, select which doctor is in charge for this. Then you can select what was the consultation reason. Maybe it is bleeding episode, maybe just treatment, consultation, etc. So we can say maybe treatment. Then we can click on prophylaxis. If you have all these details, you can fill it. You can see travel distance, travel mode, payment status. You can fill all these fields. Then we have got this weight and height. So you can basically put weight or height if there is an update in this, or if you have available those details right away. You've got this financial expense or impact box where you can put stay cost, food cost. These are all like for the for the reporting purposes. Then you've got any visit remark that you can put over here. And once you do that, you can create a visit. So with these minimum details, you can just click on and create a visit. So as you can see, the visit has been created successfully. Once the visit is created, you'll be able to you'll be able to access this medical detail information where you will be able to update all the medical details related to that patient for that particular visit. So suppose there is site of bleed, you will find ankle, knee, hip, wrist, elbow, shoulder that you can select over here, or other bleed that you can select anyone from here and say suppose you have selected this, you have selected this, and you can just click on save, and the for that particular visit these details will get saved. Then you've got this joint bleed section. In joint bleed scores, you've got various scores. You've got HGHS score, we have got fish score, we have got WFH score. If you see, we have got Peterson score, we have got Denver score. So these are like all the standard scores that are required. We have already incorporated this. So and these are like automatically calculated. Suppose you want to select, you can just select and the scores gets calculated automatically, and you can just click on save. So once you save, the fish score is saved. After that, you can click on treatment history. You've got has required, physiotherapy has been given, product given, therapy, on demand, prophylactic, care, home care, hospital care, taken for major bleed, minor bleed, all these details that you can fill. Then we've got this fibroscan where you can put input CAP score, EKPA, chronic complication, musculoskeletal complication, chronic hemophilic arthropathy, contractures, all these details that you can available at that point of time. Investigation, you've got more fields if you want to, if you have the reports, you can fill. You've got MRI scores, you've got X-ray scores, you've got ultrasound, and once all these details are filled, if you have something which is suppose you have got this factor assay available for the patient, you can click here, you can upload the file and put the comment, and you can just upload the file. You can actually upload multiple files related to that visit over here, and you can basically do it later on also. So you have the option to basically edit the medical details whenever as per your once the detail has been entered. Then you've got this ADR details. So these are like details that you can input and per visit. And once you click on visits, you will be able to see that we have got the visit done on it, and it was for consultation. Now here you can create a dose. So basically here you can also allocate medicine to the patient. So you can click on create dose, and you can see your patient is here. The diagnosis is shown here, and the product. So this is the product, means the product which is available in your inventory. So suppose right now the emicizumab injection is available and there is a 15 quantity. You can click here. You'll be able to see that there are this much vials available in your inventory. You can say allocate the number of vials and the dose quantity. I'm just inputting whatever is, and then you can put all other details if you have it, and then just click on save dose. Or if you want to put give more, allocate more medicine or give more medicine to the patient, you can click on multiple dose. I will just go and click on save dose. So once you given the dose to the patient, it was 15 and we have given. So you can see on it there is a dose ID that has been allocated, the injection or the medicine that has been given. So all these details are available now, and you can see. And this is how you actually allocate dose to the patient. Now I will show you how to search a patient. Suppose the patient is, you've got long list of patient over here. So you can basically search it from here directly, or maybe you can search it by putting the Aadhaar card. So you can give the Aadhaar card number and you can search the patient from here. Or on the top side, you will find the global patient search, where you need the unique ID that has been allotted to the patient. So if the ID is there, you can click here and you can search the patient, then you can find the patient. So here, the ID, it can search all the patient across the application. So if there are multiple treatment centers available, it will be able to give you the details of the patient wherever the patient has been registered. So you can basically give medicine to the patient even for other treatment centers. Now, here on the left hand side, you will find the TC inventory. So in this TC inventory, you will find product wise inventory. If you click product wise inventory, so we had 15 vials and we have allocated 2 vials to the patient, and there are now 13 vials left. So this is the live inventory. Then you've got the current inventory. You will be able to see consumed 2 vials and usable 13 vials. Then we have got this add purchase. So any vial, any medicine that has been allocated from the center, you will be able to see it over here and you will be able to accept it. Similarly, you will be able to see the dosing history. So all the doses that has been given to patient, you will be able to find every single dose that has been allocated to the patient. You can easily search the patient. You will be able to see all the history and you can create report. You can click here and you can select the report. Suppose the total dose consumption, you can click here and you will be able to see the dose. You will be able to see per patient dose chart. Click here. You will be able to see patient visit frequency chart. So you will be able to see, and you can easily download the Excel format. Now here in the find product section, this is again a very useful section. So in find product, suppose you are low on any inventory and you want to know which other treatment centers have that inventory. You can basically search by product name, and if that product exists in any other treatment center nearby, it will directly show you over here, and you can request that treatment center to allocate that particular product to you, which will generate a request, and then the other treatment center, depending upon the availability and request, they will fulfill it, and you will be able to see, you will be able to add that to your inventory, and then you'll be able to allocate that to the patient. So this is it. So as if you want more detailed demo, definitely we can do it. This was a pretty short demo. Please, you can connect with our team members. Thanks a lot, and thank you for the